Good morning, ladies and gentlemen. My name is Tony Capuano. I'm the Assistant Director for Cardiovascular Services at Southern Illinois Healthcare. Thank you for allowing me this opportunity to speak to you on behalf of the people of Southern Illinois, more importantly, the children, whom we can have the greatest impact on if appropriate and effective measures are enacted to help them. With cardiovascular disease, the nation and Illinois' #1 killer, it is a sad and powerful testimony that one of the leading causes of coronary artery disease is it has a high degree of being preventable. I am speaking about obesity or the collection of triglycerides, or blood fat, in our cardiovascular system. It is a proven scientific fact that as normal adults, we start collecting fatty deposits in our coronary arteries that feed our heart muscle, at the age of 25. Again, this is for a normal adult who maintains a healthy lifestyle of exercise and nutrition for the early part of their adult life. This person can expect to live out the normal life expectancy, practicing the same habits, barring any unforeseen catastrophic event. If we now remove the healthy habits of nutrition, exercise, and education, we have given this person an increased chance of acquiring a series of risk factors which have shown a decreased life expectancy, and more importantly, the quality of life we should all strive for. With obesity contributing to the high prevalence of hypertension, stroke, coronary artery disease, and type 2 diabetes, we should do everything humanly possible to establish or hardwire healthy life choices and habits for our children. I am proposing that we develop a school-based program to educate and promote healthy lifestyle for our children, kindergarten through 12th grade, for both public and private schools. I believe we should start with a daily education class on nutrition fact based on the menu selected for the day, and then talk about the benefits of the food chosen. We should promote and allow students to select foods from a healthy menu if they have brought their own meals, and then communicate that event back to their parents or guardians to allow dialogue to occur for both the child and the parent while they select the food from that menu. We should require 40 minutes of physical activity at least 4 times a week to help with the increased pervasiveness of the sedentary lifestyle seen in today's youth. It is a proven fact that one of the largest increases in metabolism or reduction of cholesterol in our bloodstream is in exercising at least 4 times a week. Not only in reducing cholesterol levels, but the multifactorial benefit of exercise can be seen in strengthening our heart muscle and decreasing the chance of developing diabetes. We should incorporate a monthly screening process and a reporting mechanism for our school children to help identify areas of opportunities for the school system, the child, and the parent. The evaluation should discuss nutrition, exercise, and current health of the student to have a non-formal score or evaluation which will be informative instead of recorded and graded. With this process, we have a golden opportunity to teach our children both short and long-term goal setting. It is a well-known fact that teaching children in order of attaining achievements will reap a lifetime of dividends for both them and us as a society. In closing, I again want to thank you for this opportunity to speak on behalf of our community and our state's #1 killer, coronary artery disease. We can reduce one of the leading causes of the disease, obesity, by promoting and developing programs, processes, and legislation towards that aim. I believe our greatest form of return on these endeavors will be in today's youth, who should not squander their quality of life or an opportunity to hardwire the lifestyle they deserve. Thank you.
Thank you. You know, there was one thing you were talking about the educational system starting, with the class, early on, and what kind of recommendation would you give for the transition? Because everyone really, we look at the baby food and the bottles and, formula and breastfeeding, and, we have all this concern about the baby up to 1 year, 2 years, and then they start crying. I guess that's when we turn our minds to other things. But then we make this transition into another type of eating style that we don't really pay attention to or don't put as much concern in. So do you think we need to change our attitude? Or?
Absolutely, Dr. Arnold. I think that we should maintain that same mechanism of reporting as we've seen the daycares and child cares. They show you the menu selection that they gave your child that day, and then bring them back home and have some type of reporting mechanism that they can have a conversation with, saying, we fed them these 4 nutritional components, these are the reasons why. And then educate the children on why they did that, just to help the parents understand why this is being done and the benefits seen at home and in the school system.